Hello, my name's Adva Saldinger, and I'm a senior reporter here at Devex, and I'm your host for this week's edition of This Week in Global Development. Uh, Anna and Jenny, I want to thank you both for joining me today to talk about the sort of news that we're watching this week. So thank you both for being here.
Thank you.
Thank you.
Jenny, I want to turn to you first because next week is the World Health Assembly, which is this really key moment every year for global health. And it comes this year, obviously, at a time of great change. And I think concern and turmoil for global health as a result of the U.S. aid cuts and other cuts as well, which are really putting the strain on the global health system. So can you give us a sense of sort of the backdrop and what the mood is going into these meetings?
Thanks so much, Adva. Yeah, it's really an interesting time for WHA. It's a big event. It's one of the biggest events, if not the biggest event for global health. But we know we're going into WHA this year hearing a lot about job cuts, right? Hearing a lot about restructuring. We know everyone's just been severely affected by the, U.S. funding cuts. And so that's actually one of the things that I asked WHO. They had a pre-briefing earlier this year, and I asked, so how WHO is going to be different this year, given, all of this, and given what's happening at WHO. We've just heard huge changes in terms of its senior leadership. And we're expecting more changes in the coming weeks and months. They said it's pretty the same in terms of the number of people going to WHO. I think if I remember correctly, they mentioned 3,000 people coming in, and they still don't have the final list of delegations at the moment. So we don't know if that's going to blow up. But we know WHO, for example, has been cost cutting. And so, they mentioned about, they're limiting evening sessions. We'll see if that happens next week, given the jam-packed agenda. They're also looking at cost cutting around interpretations. So in terms of the volume of people going, we may expect really huge sums of people still. But the mood, I'm not so sure. Definitely, we've heard just a lot of big announcements in the lead up to WHA, and so I can imagine the mood's just a little bit different as in previous years. But I'm also hearing people looking at looking at all of these cuts as an opportunity, and so there will be a lot of discussion around innovative financing, sustainable, trying to get sustainable financing. And so there's also a resolution actually about getting countries to raise more domestic financing and transition out of external finance. So it's definitely something that worth looking forward to.
You mentioned some staffing changes and some changes at WHO itself, which is in response to some, pretty major funding cuts. Can you tell us a little bit about the news this week about sort of who the new leadership is and what that means? And sort of my understanding is it's a really significant reduction of senior level staff at the agency and a reduction of departments and things like that. So tell us a little bit about the staffing changes and structural changes at WHO.
That's correct. Well, just a little bit of background. We all know that WHO is one of the first casualties of the new U.S. administration with the announced withdrawal of the U.S. Well, technically, it's not yet fully implemented, right? Because it's supposed to run for like a year. But we know the impact is already being felt. WHO has like a 600 gap in its budget just for this year. It faces more than $1 billion funding shortfall for in the next 2 years. And it's already slashing its budget ambitions for the next 2 years, actually. But given that it's, the dire funding situation, it really needs to shrink its workforce. And we've known about this for a couple of months now. Tedros, I think it was last month, announced this in an internal memo to staff that they'll have, they've done some cost cutting measures, but it's just not enough. So they need to shrink their workforce. And one of the things he did mention is we'll start with senior management. And now with the announcement yesterday it's a bit of both a bit of a surprise, but at the same time, people I've been talking to are kind of accepting it. They're actually anticipating it already this week, because there was a mention to staff early in the week about we'll be announcing the new leadership soon. So a bit of a surprise because that's a lot of senior leaders that are really leaving WHO. But
How many senior leaders are we seeing leave? What is the
was
magnitude?
From 12 to I think it's around 6 or 7. 6 to 7. I hope I'm correct with the numbers right now, but like 6 to 7 leaders that are leaving. Um, and then some of his senior leadership are staying. People like Dr. Jeremy Farrar, who's the WHO's chief scientist, Dr. Chikwe, who's currently acting regional director for Africa, but now he's going back to headquarters to take over Dr. Mike Ryan's job to lead the WHO Health Emergencies Program. You've got Dr. Yukiko, who's been leading the divisions on antimicrobial resistance and access to medicines. She's now taking up the division on health systems. So he's still maintaining some of the people in his senior management. But he's losing about almost half of them. We've got some people who's staying on their jobs, like the head for business at operations, but and then there's Dr. Sylvie Brand, who's taking on the work of the WHO chief scientist. So yeah, that's
So
big
some of it
changes,
is
but
moving around
yeah.
people to different positions as they're sort of consolidating.
But one of the things that I'm hearing as well is that people are accepting this new leadership. They said it's geographically and gender balanced.
And my understanding is that Tedros said that was like part of the goal in sort of his selection as well, right? Is to
Yeah.
sort of achieve that. Tell us a little bit about sort of structurally how you think WHO will change. Are there things it will focus on or things it will not do now that it's being forced to shrink? And how will that be reflected at WHA and what is sort of prioritized or discussed?
One of the things that came up during the WHA pre-briefing this week is that, and this was being announced by Dr. Katharina Boma, who's the ADG for External Relations and Governance. But of course, she didn't hinted on what's going to change when she was doing that. But she mentioned about the announcement and the leadership change. But one thing she mentioned was that she doesn't think there will be more announcements coming regarding the restructuring during WHA. But at the same time, it's just impossible for us to assume that this won't be the talk of the town at next week in Geneva, right? One of the things ever since the restructuring has become known publicly is that what does that mean in terms of WHO's work? And I think we're still trying to get a sense really of what does that mean, because one of the exercises they did is they looked at what we should definitely prioritize and then what can we sunset, and it's not clear yet where the sunsetting or what things are they going to be perhaps giving up to other organizations for other organizations to lead. So that's something we'll definitely be keeping a close watch on in the next few weeks and months.
So you mentioned earlier that the U.S. has stated its intention to withdraw, but that process takes about a year. Do you expect U.S. participation at WHA? Do people think the U.S. is going to show up, and what might they do or say if they are there?
So interestingly, when the U.S. announced the withdrawal in January, we weren't expecting a U.S. delegation at the executive board meeting in February, but there were U.S. officials at that board meeting. They hardly spoke during that period. And so now it's also a question that we've actually asked, the health department of the U.S. We've reached out to the Geneva mission, at the U.S. mission in Geneva, whether there be a U.S. delegation. We've also asked WHO if they're expecting a U.S. delegation, and I think we'll only know for sure on Sunday, because that's when they will be publishing the list of delegations for WHA. But it would be interesting, to be honest, if we'll have someone and what they will actually do there, if they're not going to, engage in discussions.
Yeah. What else you're sort of looking at or expecting next week? Are there key issues, diseases, things like that are sort of, part of the key themes or expected discussions?
Before I move on to issues, I just want to maybe wrap up on the WHO thing. It's also a big, the WHO is also expecting, well, hoping that member states will increase their membership dues, so they get more predictable funding. That's not yet guaranteed. There's been some pushback in the earlier board meetings on that. There's also going to be a last investment round event next week. So we heard there'll be some philanthropic organizations there. We don't know how much money WHO is expecting to raise from that. But again, that's all about WHO trying to fill the gap in their funding shortfall at the moment. And then when it comes to other issues, the biggest one is the pandemic treaty. We've been talking about this for more than 3 years. We were expecting an agreement last year. It didn't happen. And so, there was some skepticism that, perhaps, given the U.S. withdrawal, there will no longer be an agreement. But member states were able to reach a consensus on the text. And now, they're now gearing up for adoption of the pandemic treaty. It's one of the first things they're actually going to do next week.
One of the things that you mentioned is the WHO budget, but I imagine, and you sort of talked about, that the innovative finance could also be sort of a key part of the conversation, because people are trying to figure out how do you make up for these shortfalls. And yeah, domestic resource mobilization can be part of the answer, but in some countries, they just simply don't have the resources that they need to support their health budgets. What else do you think we might see on health financing in that discussion? Is it going to be focused on other funders, the likes of the Gates Foundation, which is a huge funder in the global health space? What do you think we'll see on that front?
There's a lot of talk about innovative finance and trying to align donor funding now, funding from external organizations to the priorities of countries. Now, it's not exactly a novel idea, right? Like, a lot of people have been talking about this for quite some time, but people may be taking this more seriously now, given that how unreliable they've seen external aid funding is at the moment. I just want to mention, just this week, Gavi announced a partnership, the first partnership they're having with the AIIB, wherein the AIIB will be providing up
For
to...
folks who don't know, the AIIB is the Asian Infrastructure Investment Bank.
Right. And they'll be providing up to $1 billion, as part of this partnership. And what Gavi is really looking at is blending its grant financing with, loans coming from AIB, and, help get countries to spend more really on health. Because sometimes when you think about loans, it's always about infrastructure, little on human capital. Well, it's maybe except for the World Bank, which is, has done a lot in that front. But that's what's exciting about this partnership, because you kind of see, the Asian Infrastructure Investment Bank coming into the health space and really having this partnership with Gavi, and Gavi saying, we're not only just looking at AIIB, we're actually looking at other, partnering with other MDBs. So I think, that's one indication that organizations are really looking at different ways to raise more money or multiply the impact of their grants.
I think that's really interesting. Gavi has a history of really interesting partnerships and has worked with development finance institutions as well. I know they worked with the USDFC on some sort of innovative financing instruments that are more private sector driven instruments. So I know that they have a team there that looks at these things, and it's probably even more important now than it has been in the past for them to find some of these new partnerships. One of the things we've seen here in the U.S. is that future U.S. funding for Gavi, I think, is an open question. I think will come down to action in the U.S. Congress, but at least from early indications, we think that this Trump administration will not support funding for Gavi, which is, I think, came as a surprise to a lot of people. So I think it's one thing, especially to watch this year with sort of Gavi funding. As we're on this sort of funding of other sources of funding conversation, Anna, I wanted to bring you in. We talked last week on the podcast about the big Gates announcement that they were going to sort of spend down and close the foundation. And so I'm curious if you have other thoughts on that. I know you had an opportunity to speak to Mark Sisman at Gates, and what your impressions are of sort of how philanthropy is responding in this moment.
Yeah, sure. And it's interesting on the note about Gavi. I did go to an event that was celebrating the 25th anniversary, which coincided with the announcement that they're going to double their giving by $200 billion over the next 20 years. And like you said, sunset the foundation in 2045. And Bill Gates mentioned Gavi, and he seemed to kind of express pessimism that the replenishment, would go very well. He openly talked about the fact that they could get 50 to 60% of what they got during the last replenishment. So I think that was just an important thing. And, he had a very long speech and long remarks. But that was really notable, I think, kind of showing that there's a realism and pessimism overall on these replenishments. And he didn't, of course,
was sort of instrumental in helping create Gavi, right?
Yeah.
And I guess, was there any indication that because of these shortfalls, Gates would increase its giving to Gavi, or we didn't get any hints?
He cut it off right there and didn't really give a lot of clues as to what, would Gates step in at that point if the replenishment is a disappointment. But I think, from attending the event and talking to a lot of philanthropy experts, it really seems like it's good news on the health front, because what Gates is doing is doubling down on what it does well, which is primarily global health. I think there were some hopes that, given the foreign aid cuts, that philanthropy would come in as this kind of substitute, and specifically Gates, which is arguably the most important foundation in the world, would come in and maybe, really help plug the gap. But they've made it clear that they're not going to expand their remit to, let's say, promoting democracy or something like that. They're sticking with what they know works. Again, primarily global health, education, lifting people out of poverty. They have said they're certainly exploring artificial intelligence, and they've got a lot of innovations in the pipeline. So it's not like they're going to be this static organization for the next 20 years. But in terms of their mandate, they're still seem very laser focused on it. So that's good news and bad news, depending on how you look at it. The only other thing that I wanted to mention that I thought was really interesting at the New York event, and kind of goes with the trend that I've seen in terms of Bill Gates, was it's kind of his evolution when it comes to the Trump administration. He famously met with Donald Trump before Trump took office at Mar-a-Lago to talk about his priorities. He said, and he told the Wall Street Journal it was a very productive meeting. And then shortly before coming into office, President Trump really decimated the foreign aid system, including a lot of the health programs that Gates has championed for many years. So Gates did not forcefully initially push back then. And if anything, I think there was an incident where the foundation had a scholarship fund that was initially only open to students of color, where they expanded it to white students just to kind of, as part of this DEI backlash. So there were some questions that the foundation is taking a really cautious path when it comes to the administration. And you could see that caution, echoes of it, still at the New York event. Bill Gates is a lot more vocal about the Trump cuts. He called them tragic at the event, but he's a lot less vocal about calling Trump out specifically by name. He's gone after Elon Musk. We've seen in a lot of media interviews, but again, he still expressed some hope, and I don't know if it's kind of misguided optimism that he could talk to Trump and that the aid cuts would not be as deep as some people fear. But that could just be what he's projecting outwardly, behind the scenes, the foundation. There could be, I'm sure that there are intense discussions about what to do in terms of, proposed legislation that would hurt philanthropic foundations. But outwardly, there was a sense of caution, at least when it comes specifically to President Trump.
Yeah, I think one of the things we've seen is not only obviously this sort of decimation of foreign aid, but a real uptick in sort of confrontation with philanthropies and with nonprofit organizations. And there have been moments where we've thought we're going to see executive orders coming down the pipeline that would really either target specific organizations or generally organizations working on climate issues and make it much more difficult for them to do their work in the U.S. or to fund work abroad. We haven't seen that, but one of the things we did see this week is a bill that's making its way through Congress, and Trump has called it, the one big beautiful bill, and it's essentially a massive budget and tax bill that Republicans are trying to get through Congress. I think it's like 389 pages or something. But the parts that I think the Devex audience will care about are really the implications for philanthropy and for nonprofit organizations if this bill does pass. And there's a lot of politics to get that across the line. I think it's not necessarily a given that it will pass in its current form, particularly because of some requirements in the Senate. But Anna, can you tell us a little bit about what is in that bill and what the ramifications would be if it is approved or passed?
Yeah, and to your point, initially there was talk that this would involve nonprofits and foundations, especially that dealt with climate, that they would, that the administration with IRS would revoke their tax-exempt status. That didn't come to pass, but the reprieve was short, and we've got this legislation now. For philanthropies, one of the main things it does is introduce a tiered tax system, and our reporter Alyssa Milani details this really well. But basically, if you maintain the current a tax rate on investment income of 1.39%, only if you are a foundation below $50 million. If you've got assets between $50 and $250 million, it would be about a little less than 3%. Those between $250 million and $5 billion, it would be about 5%. Any foundation with assets above $5 billion, so now you're thinking the Gates of the world, their tax rate would raise to 10%. So just think about that, went from 1.3.9% to 10%. That's the proposed plan. There are other aspects that are really important, especially to the global south. There would be a 5% tax on remittances from non-U.S. citizens. That, of course, remittances are a huge source of income for countries in the global south, much larger than foreign aid in general. So that's also another point to keep an eye on. As you said, it's kind of making its way through Congress. It's made its way through a key committee, but there's a lot of politics involved before we can see any of this come to fruition. There's a lot of domestic debate over cuts to Medicaid, health insurance, the fairness of the bill, of the tax cuts for high-end earners versus lower-end earners. So you still got to deal with the Senate. You got to deal with reconciliation. So it's a far cry from being done. But so we will see if these provisions for philanthropic foundations hold. But they certainly held during this last, hearing in terms of the House Committee on Ways and Means. And I think that there is a good chance that some of these will survive if the bill in totality makes it to the president's desk. And that has, like you said, huge implications. If you lose the tax deductions, it doesn't motivate people to give to charity. It's a huge hit to charity. And
if suddenly these foundations are being taxed at 10 times the rate they're being taxed at, that means they have less money that they can give out, right, as grants, etc.
Yeah, and again, so we're a ways away from that, but already we're seeing foundations kind of team up. Wall Street Journal had an article that the very wealthiest foundations are kind of informally banding together, of all political stripes. So not just like the Gates, but Charles Koch Foundation, for instance. So other conservative foundations. And beyond the large ones of the Gates that we often talk about that I've mentioned repeatedly today, there's like the Council on Foundations, Philanthropy Roundtable, various other organizations and coalitions that are getting other foundations, hundreds of them together to really at this moment at least speak up, call the Republican lawmakers, stress why, foundations are important. And so there's more of that kind of legislative activism, but we've only seen the beginning of it. So it really remains to be seen how active.
And what are some of those organizations sort of saying about the potential implications? I know Council on Foundations has been pretty vocal about it, and Alyssa spoke to them for this story. But what are they saying about the challenges that this would create, or how it would change the industry?
Yeah, basically that it would hurt the people who hurt the people who rely the most on this charitable giving. I mean, Bill Gates himself, going back to Elon Musk, has made a very strong argument that the world's richest man has been involved in the deaths of the world's poorest children. These foundations are not necessarily going to go to that extent in making that argument, but certainly I can imagine that they will start to pick up on the fact that these are, tax cuts for disproportionately do benefit the wealthy. And this would put a huge dent in charitable giving. So it would hurt the people who need it the most. And they are already kind of making these arguments that, again, this is hurting people. And down the line, same thing with remittances, for instance. There's already a lot of arguments coming up that if you increase or decrease remittances going to global South countries, it will increase migration to the United States because people will be seeking greater economic opportunity. So I do foresee some of these kind of America First type arguments being made. But like I said, for now, it's kind of just banding together for free speech. This is also, involves universities such as Harvard. So, but I suspect there will be a lot more in terms of an argument of that this hurts the people who most need the charitable giving.
Another element that's in the bill that I found interesting was that it would allow the government to revoke the tax-exempt status of organizations that it says supports terrorists. And I think we have seen sort of a wider interpretation of support of terrorism from this administration. And so my understanding is that is also sort of raising concerns that swath of organizations that maybe don't align with the politics of this administration could be targeted for removal of their tax-exempt status.
Yeah, exactly. I mean, you summed it up well. It's, the criticism of that is that it strips organizations of due process, basically, that the Secretary of the Treasury can arbitrarily designate nonprofits as terrorist supporting entities. Then they have to fight that designation. It's almost like a process that goes backwards. And there's a lot that goes into making that type of accusation and designation. And once it's out there, it's already hurting the foundation's reputation, even if they're able to appeal it and eventually, it doesn't come to pass. So that's a huge criticism. And I think that's a really important part of what, nonprofits fear, that it's going to be in the guise of this politically motivated attacks. And, you're going to go after the foundations that are perceived as too progressive or too opposed to President Trump's agenda. And that this is an easy way to target them, basically.
Great. Well, I think we're probably running short on time here, but I wanted to thank both of you. And I wanted to just let our listeners know that we are doing a lot of online events these days, really critical conversations, for example, about sort of the future of the UN in the era of the Trump administration, looking at European donors and countries and what's going on there. And so I would encourage you to take a look at some of those events, see what we have that's coming up. And certainly next week at the World Health Assembly, we have a lot of events that I believe you can live stream and join online if you're not there in person, to really dive deeper on some of these issues. And I'll just mention that we're continuing to keep an eye on some of the legal challenges that a variety of organizations have brought forward. We've seen a bit of movement this week in some of those cases. And I'm continuing to track the Millennium Challenge Corporation story where, we're still seeing that's an agency whose fate is still up in the air. But this week we did see that the acting CEO resigned her position, and the first Trump administration political has arrived at the agency. So I think we're all waiting to see sort of what happens, but we expect it may play out in the coming weeks. So Anna and Jenny, thank you both so much for sharing your insights today, and for everyone who joined us, thank you.